Hello, everyone, and good evening, and welcome to the first ever Different Brains webinar. I am very excited as today we have a very special guest with some awesome information to share. But before we get into it, I would like to give you a little bit of background about Different Brains and myself. My name is Emily Buckley, and I've been a Different Brains intern for almost 2 years. I have recently graduated from Florida State University on a pre-medical track and received my bachelor's degree in psychology with a minor in biology. I've developed a love for Different Brains because of the amazing work we do to educate and bring awareness to society for neurodiversity. Different Brains is a nonprofit organization that strives to encourage understanding and acceptance of individuals who have variation in brain function and social behaviors known as neurodiversity. Our mission has 3 pillars. One, to mentor neurodiverse adults in maximizing their potential for employment and independence. Two, to increase awareness of neurodiversity by producing interactive media. And three, to foster the next generation of neurodivergent self-advocates. Here in Different Brains, we promote awareness through the production of a variety of neurodiverse media content, including our multiple web series, blogs, podcasts, movies, and documentaries, all available for free at differentbrains.org. We also feature a mentorship program through which we aid individuals in taking the first step towards achieving their goals, finding their voice, expanding their social skills, and understanding of the professional world. To find more information on Different Brains, our content, or our mentorship program, please visit our website at differentbrains.org. But for now, the reason we are all here today, we are so honored to have this guest with us. Dr. Marsha D. Brown is a Florida licensed psychologist with specializations in forensic and clinical psychology. She has extensive experience in the assessment, evaluation, diagnosis, and treatment of children, adolescents, adults, and families across a variety of settings. Forensically, she conducts psychological evaluations in family court. She is also hosting a podcast being launched on November 24th called The Self-Care Chronicle, which is available on Apple, Spotify, Google, and Stitcher. After the lecture, Dr. Brown will be answering any questions you may have, so feel free to submit your questions throughout the webinar through the Q&A option at the bottom of the screen, which will be monitored by Different Brains intern Sarai Welch. So now, without further ado, Dr. Marsha Brown.
Thank you so much. Hi. Thank you everyone for joining us today, and thank you Different Brains for having me. I'm going to go ahead and share my screen with everybody. Okay. So as you know, today we're going to be talking a little bit about deconstructing sadness. And we're going to talk a little bit about depression. So we're going to talk about what depression is. We're going to talk about some tools to recognize it, to understand it, and to manage it. So let's go ahead and get right into it. So in terms of what we're going to talk a little bit about today, we have about 30-ish minutes, and then we're going to leave some time for questions at the end. We're going to talk about what depression even is, because before we talk about something, we want to make sure that everybody is on the same page in terms of what we're looking for and what we're looking at. We're then going to talk a little bit about COVID-19 and depression. We're going to go over some myths about depression that you may or may not have heard. And then we're going to talk a little bit about what to do. If you or a loved one has symptoms of depression, what do you do? And then we'll talk a little bit about when it's time to get help. I do want to mention, again, we have about 30 minutes today, so this isn't meant to be an in-depth or comprehensive talk on depression. It's just really meant to give a basic overview and a basic understanding of depression and how to spot it and what to do if you encounter it, okay? So first, when we talk about depression, you know, a lot of people have their own idea of what depression is, what that means to them. And really when we're looking at it in terms of, for example, for a psychologist, what we're really looking at is depression is a mental illness. It's considered a mental illness. It's a mood disorder under mental illnesses. And as you probably may have pictured in your mind in terms of what depression is, it involves sadness, okay? But it's not just sort of down in the dumps sadness, because we all get sad sometimes, right? It's normal. It's a normal part of life. Sometimes we're sad. Sometimes we're feeling a little bit down in the dumps. But really, when it becomes constant, when it becomes something that you just can't sort of get out of, when it becomes for an extended period of time, and when it interferes with your life, then that's when we're looking more towards somebody that we would say is depressed. It's when the sadness just won't go away and you can't really shake it off. Okay. So that's what we're talking about here when we're talking about depression. All right. So let's talk a little bit about symptoms of depression. Some common symptoms are really just being in a place where you're not really enjoying the things that you used to. So if there are certain interests that you used to have and you're no longer enjoying them, or they're kind of boring to you, or you're just not really interested in doing them or exerting the effort to do them, that could be a sign. Having major changes in weight and or appetite. So if a person gains a lot of weight, technically it's over 5% of body weight, change of 5% in body weight. So that's either losing weight or gaining weight. Because for some people, when they're depressed, they don't really like to eat. Food doesn't quite taste right to them, and they just don't, want to eat anything. Other people, when they are feeling depressed, they just eat and eat and eat and eat. And so those changes in appetite during depression can lead to significant weight loss or weight gain, depending on which way it swings for some people. Something else to keep in mind is that for people who suffer from depression, when they have multiple episodes of depression over time, these symptoms don't necessarily stay the same. So for example, if they have one episode of depression, they may not feel like eating anything and they may lose weight. And so maybe a couple of years later, if they go through it again, they may eat, everything in sight, and they may end up gaining weight. So it really just depends on the person, and it depends on the episode. So also with depression, you see major changes in sleep. So for example, a person that when they're depressed, they feel like they just don't want to get out of bed. They sleep and they sleep and they sleep and they just do not want to get up. You can also have changes on the other end of the spectrum, which would be a person who can't really sleep because maybe they can't shut off their head. Maybe they're just ruminating. They're thinking about all of the things that they're concerned with, all the things that are going on in their lives, everything that they are sort of hyper focused on. You can also have changes like not being able to fall asleep, so just sort of tossing and turning. You can also have changes in sleep like not being able to stay asleep. So for some people who have depression, even though they may be able to fall asleep right away, they may wake up in the middle of the night and just toss and turn and not be able to get back to sleep or shut their mind off. There can also be some trouble with just, some people describe it as foggy headedness, so that difficulty concentrating, feeling like they can't really focus or can't really think or can't really solve problems as well as they used to be able to. Those things can be symptoms of depression. Also just fatigue or exhaustion, or just being very tired all the time without really feeling like you can identify a reason why you're feeling tired all the time. Also, any of these feelings of excessive guilt, or feeling like you are worthless or useless or helpless or hopeless. So feeling like, I know this situation is bad. I'm unhappy, I'm sad, whatever it is, but feeling like there's nothing that you can do to stop it. You're helpless to change the situation or make things better. Also, feeling hopeless, like there is no hope. This isn't going to get better. It's just going to continue to get worse, or it's just going to continue to stay the same. So really those kind of feelings are the things that you're looking for in terms of symptoms of depression. And again, I just want to mention that it's different from everyone. And it's not just so we're clear, it's not just one of those things where if you have experienced or you've seen someone experience one of these things on the list, then that means that they are experiencing depression. It doesn't really work like that. There are a lot of different sort of qualifiers in terms of how long the symptoms have been experienced, the number of the symptoms that have been experienced, and that's beyond the scope of what we're talking about today. But just keep that in mind that just having one of these on the list, one of these experiences, does not mean that a person automatically would meet the threshold for depression or a diagnosis of depression. And then finally, a common symptom of depression is just thinking about suicide or thinking about dying. So for some people, you'll hear a lot of people when they're depressed say things like, if I didn't wake up tomorrow, I would be okay with that. So that kind of thing, where it's just they're thinking about what it would be like if they didn't wake up. Maybe they think about, if I didn't wake up, that would be fine. Maybe they think things like, if I didn't wake up or if I weren't around, maybe my family would be better off, or maybe my friends would be better off, or maybe everyone would be better off. It's those kinds of thoughts. And again, if you're experiencing several of these things, it may qualify for a diagnosis of major depressive disorder. That sort of diagnosis, there would have to be an evaluation by a mental health professional, but we'll talk about that in a couple of minutes. So these are some of the common symptoms of depression that you may or may not be familiar with. You may or may not know someone, or you yourself may have experienced them. So let's talk a little bit about some of the things that might sort of contribute to feelings of depression. So we're all aware that 2020 has been quite a year. We've had the pandemic, which just sort of disrupted all of our lives. It impacted the world. And so what we've seen is an increase in depression. Unfortunately, we've just seen that there's so much going on at any given time. We've seen unprecedented changes to our lives in early 2020. I think that for many of us, if not most of us, if you had told us this was coming in 2020, like if a year ago you had said that things were going to be like this, I think a lot of us would have had difficulty wrapping our heads around it, right? Because this is just completely different from anything we've experienced before. We've been, having lockdowns, there have been quarantines. We have had to, change to, online formats for meetings, for work, things like that. And it's disrupted a lot of our lives socially, career-wise, things like that. So collectively, a lot of people are dealing with, the fear of getting sick, that constant fear of, what is this virus and will I end up, contracting it, and what will that do to me? What, happens with my loved ones? You have that grief over the losses of life. So, many people know someone who has been impacted by COVID or has died from COVID. So, and even if, you don't know anyone personally, we're constantly seeing on the news, on the internet, everywhere we look, we're constantly seeing what the death count is, and it's constantly going up. And, we've been watching this since about March in terms of people getting sick and people dying. And that has an impact on us because we're constantly seeing this everywhere we look. We also have trauma from just the widespread death and disease around us. This social distancing that we've, never done before. and it causing us not to be able to do very normal things that maybe we used to do on a regular basis. For example, go to the grocery store, go to the movie theater, go to the gym. This social distancing and the physically having to distance ourselves from people has put into play a whole new variable that we really hadn't imagined even a year ago. For a lot of people, they have a lot of financial concerns. So a lot of people lost their jobs, or they were reduced, their hours may have been reduced. For people that may have been able to keep their jobs, maybe their job depended on customers coming in, people physically being present in their place of business, and all that was taken away. In terms of housing, for a lot of people, there are housing insecurities and worries about being able to keep a roof over their heads. Not having access to social support systems, not being able to go out and do the things that you were able to do before. So really loss of different communities. And so, as I said before, with COVID, we've seen an increase in depression, and in the Journal of the American Medical Association, there was a study that was recently published that talked about the significant increase in the number of Americans who now meet the criteria for a diagnosis of depression versus the number who met those criteria prior to this pandemic. And it's actually 3 times as many people meet the criteria for depression now during the pandemic than they did prior to the pandemic. So it's impacting all of us, and the people who are, lower income, have a lower amount of savings, are exposed to more stressors. So frontline workers, people who are in businesses that are considered, necessary businesses. All of this impacts us. So even if we're not directly impacted, we're still seeing it around us. We're still seeing this happen. So it impacts us. So in terms of thinking about depression, thinking about how the environment can lead to depression, or how the environment not can lead to depression, but how the environment can be one of the triggers for later development of depression. These are some of the things to just sort of keep in mind. Okay, so now that we talked about these things that can be factors in developing depression later on, let's talk a little bit about myths about depression. I'm not sure if you've heard any myths about depression, but I hear a lot of them all the time. And so I like to just sort of address them when I can. So the first myth is, I hear a lot of people say, you just have to power through it. You have to have a stronger mind. You have to just sort of don't think about those things. Don't think about sad things. You'll be fine. Just power through. If you are strong-minded enough, you'll get through depression. And, to be very clear, that is completely untrue. Depression is, as I said, a mental illness, and a mental illness is not the result of a weak mind or a lack of willpower. And just remember, depression can strike anyone. It doesn't matter what, mental fortitude or anything like that. And depression and the strong mind aren't really two things that are related. So next myth, depressed people could just snap out of it if they were motivated to stop feeling sorry for themselves and adopt a positive mindset. That's not true either. Depression is not caused by a negative mindset, and a person who's struggling with it can't just snap out of it. They can't just shake it off. Depression is very complex, and there are a lot of different factors that go into whether or not a person will develop depression, and also how that will impact their lives. So just keep in mind that that's not true. It's not about snapping out of it. Our next myth is depression only happens in response to a major event like a trauma. So we talked a little bit about COVID-19 and depression, and how we've seen a significant increase in the number of people who meet the criteria for a diagnosis of depression uh, after the pandemic or during the pandemic versus prior to. And so, although things like, major traumas, this, pandemic, difficult situations in general can trigger episodes of depression, it's not always the case. And another thing that, I always like to point out is that, just because someone looks fine on the outside, just because, they look like they're okay, they can still be depressed on the inside. One of the things I like to say is everyone's struggling with something. We're all struggling with something, no matter how it looks on the outside. There could be a whole different story on the inside. So just, always keep that in mind. Um, if you can get out of bed and go to work or school, you're not depressed, is another myth. And that's not true. As we, mentioned before, people can be struggling with a whole lot of different things, so many different things. And, we don't necessarily know about it because we're not them. So a lot of people who struggle with depression, they may still go to work, they may still go to school, they may still, try to engage as much as they can in the things that they need to engage in. Depression has varying levels of severity, differing impacts on people's lives. So it's not a matter of, well, if I'm up and going, I must be fine. I must not be depressed, or, that person must not be depressed. That's not generally, the way it works. Depression can look many different ways, many different ways. Okay. So now that we talked about, what some of the common symptoms are, what some of the myths are, the way that COVID-19 has impacted our lives and how that could be a contributing factor to, triggering depression in some people. So what if you have seen this? What if you have seen this in yourself, or what if you've seen this in a loved one? What is there to do? What are some things that might help to sort of mitigate the impact of whatever might be going on, whatever the environmental factors might be, whatever a person's dealing with at the moment? Some things that may help is talking to the MHP as a mental health professional, and just going to talk to somebody about what's going on and see if you can come up with a game plan to get you back to where you feel like you're able to function again. Also, it helps to keep a routine, and I think this is especially relevant for our situation where we've got the pandemic that's still raging around us. And so for a lot of us, we're working from home, or only working in an office a few days a week, but we have altered schedules, and there are a lot of things that we can't control in terms of our schedules, in terms of work, in terms of the kids being at home because maybe they're doing online school or whatever the case may be. But it helps to keep a routine, because that's one thing that you are often able to control. So that just means, getting up and going to bed at the same time, having meals at the same time, making sure that you're exercising, things like that, to sort of maintain some semblance of normalcy. Also, reaching out to your support network. It's been difficult because a lot of times we're used to seeing people face to face, or we were at the beginning of 2020 prior to everything shutting down. But it's really important to keep those connections so that you do have somebody to talk to, you do have somebody to, just connect with on a regular basis. Also, if you see somebody else that is in distress, or somebody that seems like they're sad or they're not feeling so well, don't ignore it. Don't say, they'll snap out of it, or, I'm not going to bother, or, I, don't want to intrude. Ask them how they're doing. Ask them if they're okay. Just, sometimes it just helps for people to, to feel better, to make a connection, and also to know that somebody cares enough to ask how they're doing. And then self-care. So making sure that you are eating well. So, now that we're at home, we might not necessarily be going to the gym or exercising as much as we used to. And so, there are comfort foods around. And for a lot of people, when they feel, stressed out or there's a lot going on, the first thing to go is the diet in terms of eating more comfort foods and eating foods that are a little bit less healthy. Also making sure that we get enough sleep, and also exercise and get moving, get your body moving. So these are, again, 5 things to try. So of course, that begs the question, what if none of these things work? What if you've tried these things? You've talked to someone, you've kept a routine, you've reached out to your support network, you've done all these things, but you still just, you don't feel right, you're very sad, you feel like things aren't going well, and you just can't see the light at the end of the tunnel. So that's very important, and it's very important to be aware of that, because it may be time to get help. And so how do I know when it's time to get help? What are some of the things that might be happening? So a few slides back, we talked about thoughts of death or thoughts of dying, thoughts of, maybe the world would be better off if I weren't around. Or, maybe if I didn't wake up tomorrow, I'd be okay with that. That is definitely a sign that it's time to go and get some help. Being unable to do what's necessary to care for yourself. So just being in a place where you're not taking care of the showering and grooming and things like that, or just feeling overwhelmed. Or always, if you just feel like you need someone to talk to, you don't have to wait until things are overwhelming in order to reach out and get help. But these are some things that should serve as red flags, so that if you do experience them, you're going to want to go and talk to somebody. Okay. And if you just feel like you're not really coping very well with everything that's going on, and that's okay, because a lot of people are not. This is unprecedented. There is no one before us has experienced this, so there's no way that we can talk to someone and get some tips on what's going on. So if you did decide to get help, well, what would happen? How is depression treated? What does this even entail? First, there's an evaluation by a mental health professional. And then there would have to be, if you meet certain criteria, there would have to be some type of diagnosis. And then come your treatment options. So if there's an evaluation, there's a diagnosis, and the mental health professionals believes that the mental health professional believes that you may be suffering from depression, there are a bunch of different treatment options. That's, again, kind of beyond the scope of what we're talking about today, but know that you have options. Know that, therapy may be an option, medication may be an option, both may be an option, but there are also other methods. A lot of people sort of are hesitant and sometimes a little bit afraid that it might mean that, they have to go on medication or whatever the case may be. There are a lot of fears about what seeking treatment means. And just know that, with treatment, you have options. You're part of the process of deciding what needs to be done, what can be done to help you. So just know that you definitely do have options. And some things to remember. Again, it's okay to ask for help. It's okay to not be okay. There's nothing wrong with that. We can't we can't be superheroes. We're not superheroes. We're human, and humans need help sometimes. So it's okay to ask for it. Also remember that depression can strike anyone. It doesn't matter their race, their gender, their socioeconomic status, or their age. Depression is not something that just happens to women. It happens to men as well. It happens at all ages, all socioeconomic statuses. It can strike anybody. And also, it's okay to acknowledge, your own feelings of distress and other people's feelings of distress. It's okay to acknowledge that, not doing so well, things are not okay. That's perfectly fine. Don't have to pretend that everything's okay or pretend that none of this exists. Okay, so talking a little bit about resources really quickly. The National Suicide Prevention Line phone number is here. There are also text messaging services that you can just text instead, because some people prefer, instead of making a phone call, they prefer to text. So these are definitely resources. And then if you go to my website, I have an information sheet that you can have emailed to you that is just some information on, depression and some additional resources. Okay. And so now we have some time for questions. So does anybody have any questions?
Okay, Dr. Brown. So our first question that we have from an attendee is a person predisposed to being depressed, or does certain situations cause depression?
That's an excellent question. It's actually both. So depression does have a hereditary component, but also environmental factors can play a role. Situational environmental factors can play a role. And I also want to mention, though, that just because there's a hereditary component, there is some part of it that makes it likelier that you may develop depression if you have, for example, a parent or a sibling or something like that. But just because you have someone in your family that has suffered from depression doesn't mean that you'll automatically develop it. It really depends on a number of factors that come into play in terms of whether or not a person will develop it.
Okay, our next question is from Preston Fitzgerald. He asks, what's the best way to approach a depressed person?
That's a really good question. And I would say my answer is it depends. It depends on a few things. I would think about, I'll say some things that I would think about in terms of how I would approach it. I would think about the relationship that you have with that person, whether it's, a close relationship, whether it's sort of a passing relationship, whatever the case may be. And, keeping that in mind, decide, how you might approach the person. I would say do it, if you do decide that it's a, something that you're going to do. And I'm assuming you're talking about approaching someone who has depression to talk about, how they're doing and know, whether or not there's anything, you can do to help, or that you're just there to listen. I would also say maybe a private conversation would be a good idea, better than doing it in a group setting or a public setting or something like that, because it is very private, and we don't know how a person would react. And I would also say, although we have a lot of people around us that we love, we care about, and we want the best for them, it's not always necessary for us to give other people advice. Sometimes it's really helpful to just let somebody know that you're there to listen. You're there for whatever they need, whether it's just to talk about what's going on, to vent, or if they would like some suggestions in terms of brainstorming, then you're happy to do that as well. But if you are encountering someone who seems to be in dire straits, so seems to be really thinking about harming themselves, or really just in a bad place that's causing a lot of concern, I would say that you need to get some help, because it may be beyond just a conversation, or beyond anything that you as a friend or a loved one can do.
Okay, our next question is from Randy Friedlander. He asks, any particular treatment or practices that work better with depression with a diagnosis of also Asperger's?
Depression and Asperger's. I would say for that, you want to ask your whoever your mental health professional is, because there are a lot of factors with co-occurring diagnoses that make it so that certain treatments may be more effective than others. But really, even though a person might have these two diagnoses, doesn't mean that that person will absolutely respond to a certain type of treatment. Sometimes when we have, some support for some, research evidence that certain types of treatment may work or may be effective with certain populations. There's this idea that anyone who falls into that population should automatically go into that type of treatment. And I just want, to kind of everyone to be aware of that and kind of think that everyone's an individual and it really depends on the person and a number of factors at home, at school, at work, whatever the case may be, in terms of what type of treatment should be pursued for this person.
Okay, our next question is from Neil S. He asks, do you feel many of today's depressed people will get better when the virus is no longer a fear? If COVID-19 caused or triggered the depression?
So yeah, it's a really good question as well. What we're seeing in terms of some of the more recent research that's coming out is that yes, COVID-19 has been a factor for a number of people in terms of some of the variables that go into developing symptoms of depression. You know, who knows what's going to happen, after COVID-19 in terms of the lasting effects. I think that not just the people who've had a front row seat or who've just been kind of watching, we also have the impact of people who have actually had and survived COVID-19. So I think that those individuals as well may have lasting effects of it. I really don't know. I mean, there's no way that we can really predict that right now. But the hope is that, when these things improve in terms of, the constant fear of just, going to the grocery store or just, going somewhere, encountering people that you don't know may lead to contracting this potentially deadly virus. Once that fear goes away, once we're not seeing people, the count going up for the people who have died of this, hopefully that will decrease some of what's going on in terms of these like mental health impacts of COVID.
Okay. Paula Day asks, what are some things you can do to help the elderly who have been told to stay inside away from all of their families since they have been placed in solitary confinement?
Yeah, that's what it pretty much comes down to, right? They're, isolated because they're at higher risk, and so they can't see their families, they can't see their loved ones. I would say that still keeping those social supports and those social connections is important. So finding ways, whether that's by video conferencing, telephone calls, whatever the case may be. In some facilities, if the elderly person is in a facility, some facilities will actually they'll facilitate connections between loved ones and the person who's staying in the facility. You can also there are different applications that can send a device to the person's home so that they'll be able to connect with, and their family will have the other device, but they'll be able to connect. So I would say really, being able to keep those social connections, and if at all possible, still keeping somewhat of a routine, and still, if a person is able to, if they're mobile, still trying to at least, walk around, the residence, or, just keep sort of moving if at all possible, if they have that ability.
Kay Bonner asks, does acknowledgement of depression bring about more fear to individuals?
That is a good question. So acknowledging the fact that a person has depression, I don't know that it brings on more fears, if I'm understanding the question correctly. I think that possibly in terms of, so there's a lot of stigma surrounding mental illness in general and also depression. So there may be, by acknowledging the depression or by, telling someone that you have depression or by seeking, help, there may be, for a person who's depressed, in the back of their minds, all sorts of, self-judgment or all sorts of understanding that there is that stigma. And so thinking about what people are going to think or what this means about me as a person. So there can be that kind of increased fear or increased worry, but it doesn't, acknowledgement doesn't, necessarily make the depression worse in that sense, if that makes sense.
Dr. Robertson asks, would you say the individual's response to or perception of the trauma is much more important than the stressor itself?
Yep, I would say that it is very important in terms of their perception of what happened and their understanding of what happened to them and their understanding of their ability to manage the impact of it, the feelings surrounding it, and their ability to sort of, whatever it may be, pick up the pieces and sort of move forward in their lives. So yeah, the perception of it is incredibly important.
William Ford asks, do support groups work well for depression, or does individual treatment work better?
I think it depends. It depends on the person. So, everybody is going to respond to treatment a little bit differently. So for some people, a group it feels more supportive, and it feels like they have this network of people who are there supporting them, not judging them, who are, in their corner. And then for some people, they would prefer to have just kind of a one-on-one and talk to one person that they can, build a rapport with and establish trust with. So it really just depends on the person and what their needs are and what their symptoms are, and a number of different factors.
Okay, an anonymous attendee asks, what are the numeric estimates for those who meet the diagnostic criteria for depression since the occurrence of the COVID-19 pandemic being derived from? They also ask a follow-up question asking, is this considered more a case of a situationally appropriate or a temporary diagnosis of depression than a long-term clinical depression, such as major depressive disorder?
Okay. In terms of the numbers, I'm not sure if we're talking about like the prevalence of depression right now as it stands during the pandemic. So I'm not super clear on that, but I will say that in terms of, whether it's considered a situational thing or whether it's considered more long-term. So for people who may meet the criteria right now, they may meet criteria for, so within major depressive disorder, there are different sort of qualifiers. So you have like single episode, you can have multiple episodes, you have things like that. So it could be something where if this is the first time that someone has ever experienced these symptoms, and what I mean by these symptoms is enough of some of the symptoms that we talked about, enough of them to meet the threshold for being diagnosed as having major depressive disorder. If it's the first time that this has impacted them, and they've never had these before, it could be thought of as single episode. Depending on what their symptoms are, there are also other diagnoses that a mental health professional might give, like something like an adjustment disorder or whatever the case may be. But that's kind of beyond what we're talking about. If we're just talking about like the single episode versus the long term, it could go either way, but it is possible that these people, that have this single episode may not, after this, experience anything like that again. It's a possibility.
Anita Mitchell asks, what can you say to someone who marginalizes your depression and tells you things like snap out of it?
That's a really good question. So people don't always understand depression. They don't always understand the mental illness, and for a lot of people, um, they really do believe that it's about sort of mindset, and they think that people should snap out of it. And for some people, it's because they may have been feeling a little down one day or for a couple of days, and they decided that they were gonna just sort of power through it, and maybe they feel like they were able to. If someone's minimizing your feelings and minimizing your experiences, I would question, well, I guess depending on who the person is, I would, question constantly interacting with them because they're likely not helping. But I would also, if you feel comfortable, if you feel like it's something that you would want to do, maybe, you know, it's something that it's education. So maybe they just don't know that it's not something that you can sort of snap out of. Some people just don't know that. And then some people just refuse to see that. It doesn't matter how much information you give them; they're just not going to see it. That reminds me. I think it's a proverb of some sort that says, "There's nothing so difficult as trying to wake a person who's only pretending to be asleep." So that popped into my head for this because there are just some people that no matter how much evidence you give them, no matter what it is that you say to them, they're just not going to see it. They're not going to believe it. They're not going to hear it. And I think that rather than spending energy on trying to explain something to somebody or trying to further educate them past, if you decide, it's your decision, if you decide that you would like to educate them, if you would decide you would like to tell them more about it, beyond that, like there's nothing to be done. And I don't know that there's much value in sort of constantly trying to re-educate them or constantly trying to get them to consider your feelings and to be less judgmental towards you, quite frankly. So that's what I would say.
Fernando H. asks, people with intellectual disabilities, are they more exposed to depression? And is there any data regarding this segment?
Whether people with intellectual disabilities are more prone to depression. I'm not sure actually. I don't know of that information. I'm not sure whether or not it exists. I'm sure it does somewhere, but I actually don't have that. So I'm not able to, off the top of my head, tell you that.
Hattie Fasano asks, can you share your experience on the best type of intervention for depression?
So as I mentioned before, it really depends on the person in terms of what they're going to respond to and what their situation is, the constellation of variables that go into when they develop depression, why they didn't develop depression, like what led into it, where they are now, what their symptoms are, what the severity is, kind of what the treatment options or the best course of action would be, which is why I always encourage people to see a mental health professional, talk to somebody, and let them know what's going on. Get an evaluation if you need to, and just know what your options are so that you can be part of the team in terms of deciding what is the best course of action for you in your current situation under your current circumstances.
Paula Day asked, is it commonly known that dancing can help reduce the symptoms of depression?
I'm not sure it's commonly known. Exercise, can be impactful in terms of reducing the symptoms of depression. So that would fall under that. So I don't know if it's, commonly known. But any exercise, any kind of physical activity does help absolutely with depression. But I don't know, you know, how commonly known. I'm not sure if you mean just among the general public or if you mean mental health professionals. Yes, we know that, but I'm not sure if you mean like in general with the general public, but it actually, it can, physical activity can absolutely help the symptoms of depression.
Dexter Johnson asks, do you believe a person's self-worth plays into one's depression?
Um, if you mean like their self-esteem or their appraisal of their own value and their own self-efficacy, yes, it can play a role because if you remember, I mentioned towards the beginning, some of the common symptoms include, feeling worthless and helpless and hopeless and feeling guilty about something that happened. So for a lot of people who are depressed, they feel like they are less than, they feel like they are unable to help themselves. They feel like they are not, sometimes people will feel like they're not smart enough to get out of the situation, or they're not, smart enough to solve the problem, but they do have feelings of inadequacy sometimes. So that can be a contributing factor, just the feeling just worthless and helpless and useless and I can't do anything right, that sort of thing. Absolutely.
Monica Lobbins asks, says, thank you for presenting this very important topic. Wonderful presentation. When you have a patient who you suspect as being depressed, what approach do you take when presenting the topic of depression to the patient, and what role does behavioral therapy play in the treatment of depression?
Okay. Excellent questions. In terms of if you have a patient that you think has some type of depression, just based on, you've seen this person before, you've been working with this person, you've been treating this person before, and something just doesn't seem right. One of the things that, I mentioned a little bit ago is the idea of don't ignore it. If somebody seems off or somebody seems down or somebody seems depressed, then by all means, say something, see how they're doing, ask what's going on so you can kind of get a better idea of the situation and if there are any interventions or any kind of guidance or help that you can offer. And then can you repeat the second part of the question? I think it's what role behavioral therapy plays in, can you repeat that?
Yes. 1 second, let me see. Okay, so she asked, what role does behavioral therapy play in the treatment of depression?
Okay. So for example, I think you mean sort of like either behavioral, cognitive behavioral, things like that. So for a lot of people, again, it depends on the person. Behavioral therapy can be used to help people to identify sort of what their triggers are, as well as figure out what was happening before, what their thoughts were, behaviors were, things like that, and then set in a plan so that they're able to change their behavior, which can help alleviate their symptoms of depression. So, for example, for like some of the most basic, maybe if Sunday evenings, Sally, who's super depressed, Sunday evenings are really difficult because she gets very depressed, very down in the dumps, and for some reason that's just a very difficult time of day. You might set something up behaviorally so that Sunday evenings she goes on a walk to help, so that she's just not sitting there in front of the TV just sort of feeling bad, those sorts of things. So in terms of behavioral therapy, it's just the idea of working to identify and modify behaviors that will help in terms of the individual situation and their symptoms. And then you also have the cognitive behavioral therapy, which just looks at the ways in which thoughts affect emotions and then affect a person's behavior. So those things can, play a role in the treatment of depression.
Okay, so the last question that we have time for is from Pierre Marsh. He asks, have you found that neurodivergent individuals have a different construct of depression to others, and that a different criteria to understanding their depression?
The middle of that cut out. I had like some distortion. I'm sorry. Can you repeat that question one more time, please?
Yes, no problem.
Thank you.
Pierre Marsh asked, have you found that neurodivergent individuals have a different construct of depression to others, and that a different criteria to understanding their...
Uh-oh. Okay. So I think that, okay, sorry, I'm having technical problems. I think that for neurodivergent individuals, in terms of their understanding of the symptoms that they're experiencing that may be, characterized as depression, can be explained in different ways, so that whatever the divergence is, it can be explained in a way that they're able to kind of understand and be able to be part of whatever plan there is in terms of treating them. I would also say, though, that, and that's something that I think is a really good point to raise, I think it's really important that no matter who it is that may be experiencing symptoms of depression, it's really important to present it in a way that that fits with what their understanding is, what their experiences are, and things like that. I think that, a lot of times, well, not a lot of times, sometimes when we are interacting with somebody who might have depression, mental health professionals can use, terms or jargon that is not really understood by the person who's experiencing it. And so I think that no matter what, it's important to look at who the individual is, look at what their, strengths are, look at what their challenges are, look at the way that they understand information, the way that they interpret information, the way that they perceive things, and work with them to make sure that they're understanding of what's going on, what the treatment options are, what the goals are. Those things are really important to outline in treatment, no matter what, no matter who it is that you're treating, but also it's important for neurodivergent individuals.
Thank you so much, Dr. Brown, for all that amazing information.
Thank you. Thank you very much. Thanks, everybody. Have a good night.
Thank you so much to our audience for being here with us today. If you would like to contact us, please take a look in the chat box for all of our social media information, email, and website at differentbrains.org. And I also put all of Dr. Marsha Brown's contact information in there for you as well. Thank you, everyone. Good night.